Welcome to the Epilepsy Foundation's Ask the Expert series. Today's session, Dare to Ask and Connect, has the spotlight on Lennox-Gastaut syndrome. We're joined today by two of our leading experts from our professional advisory board. Dr. Hernandez is the Chief of Neurology and Chief of Staff at Cook Children's Medical Center and with the epilepsy program down there. Dr. David Ficker is at University of Cincinnati Academic Health Center, where he's the Associate Professor of Neurology and Director of their Epilepsy Monitoring Unit. Thank you very much for joining us today, Dr. Hernandez and Dr. Ficker.
Glad to be here.
Happy to be here.
We have a number of questions that were sent in by our users from epilepsy.com, but I'd like to start by talking about some of the basics of Lennox-Gastaut syndrome, followed by some of the treatment issues. And then on another series, we'll address some of the individual questions. So the term Lennox-Gastaut syndrome is a pretty confusing one. So I'd like to ask you, Dr. Ficker, to kind of tell us what is Lennox-Gastaut and why do we call it LGS?
So LGS, or Lennox-Gastaut syndrome, was first described in the 1960s by two physicians, Dr. Lennox and Dr. Gastaut, where they recognized a series of symptoms in a number of their patients with epilepsy. And so their names have been attributed to this condition, and we've called it Lennox-Gastaut syndrome. LGS just stands for Lennox-Gastaut syndrome. So it's a more recently described epilepsy syndrome, but it certainly it's not a new epilepsy syndrome. We've known about this for many years. It's a condition characterized by really three components. The first is multiple seizure types that generally are more difficult to control. The second is associated developmental delay or mental retardation. And then the third factor is a very characteristic EEG pattern called slow spike wave. We like to see all three of these components to make the diagnosis of Lennox-Gastaut syndrome, but as people get older with this condition, sometimes those different variables may change from year to year. So all three conditions or all three factors are not necessarily present all at the same time.
Dr. Hernandez, I understand that this occurs at all ages, so it starts in childhood and then progress. Can you tell us a little bit about who is affected? For example, what age does it usually start? How does it progress throughout the lifespan?
Like Dr. Ficker said, LGS is a rare and severe form of epilepsy. The prevalence has been estimated between 1% and 4% of all childhood epilepsy, so this is a rare condition. Although some figures have shown that is up to 10% of patients with epilepsy will have Lennox-Gastaut syndrome. The typical age range that we identify this condition is between the ages of 2 and 7. The peak time for the diagnosis is around 3 and 5 years of age. We at times have seen it more in males than in females. I'm not sure that the data is out there to prove this. About 80% of those that are diagnosed with Lennox-Gastaut syndrome will continue to have epilepsy, severe epilepsy, into their adult years.
Does what it looks like change over time? So, for example, let me clarify my question. Do you see all of the different kind of seizures start at the same time, or might you see some kinds of seizures at an earlier age and the seizure types change over time?
Well, one of the things that we tend to see with Lennox-Gastaut syndrome is about 20 to 30% of children with infantile spasms will evolve into a Lennox-Gastaut type picture, typically around 2 years of age. And seizures typically start with either tonic, atonic, or myoclonic seizures, and you can have a variety of seizure types throughout life. But typically, those patients start with the tonic and atonic type seizures. But you can have focal seizures, you can have atypical absence seizures, myoclonic, generalized tonic-clonic seizures, and the other seizures that I've mentioned.
So just for our listeners, people use different terms for different kind of seizures. So let me use a little different language and tell me if I'm on the right direction. So if we talk about the tonic-clonic seizures, some people use that term grand mal, and that would be the same thing. When the person loses consciousness, their body gets rigid, and you might have jerking movements on both sides. Okay. The term tonic seizures is when your body gets rigid and you can have a sudden fall, versus atonic where your body kind of falls, but it's more of a ragdoll fall, correct?
Correct.
Yeah. So I know it's hard sometimes for families to differentiate what's going on, because many of these are so brief. Like when they happen at night, like a tonic seizure, it might be such a quick stiffening, and you don't know, geez, is that something normal or is that a seizure? Or if a person has loss of tone and they kind of drop down, you, that's also difficult to tease out. How does the family deal with this? What's the best way of sorting out, are these events seizures?
Seizures, when they occur in sleep, they're very, very characteristic in that you will have a child that is asleep or an adult that is asleep, and suddenly they wake up with their whole body stiff. Or if they have generalized tonic-clonic seizures, they can have their body becoming stiff and the whole body shaking. So there is a specific characteristic in that you have a child that is fully asleep and then suddenly wakes up just to do this. The differential on this would be children that have or adults that have different sleep-related conditions like sleepwalking or night terrors or nightmares. And typically those patients, when they wake up, they appear to be um, incoherent, but they don't necessarily wake up and their whole body is stiff. They suddenly wake up and they either start screaming or they start having very unusual movements. And that's how we typically differentiate seizures from normal sleep patterns in children.
So then, if I were a family member of a child or adult with epilepsy, it would be important for me to be able to kind of write down what it is I'm seeing and when they happen, because it sounds like that's really important when you're trying to tease out, might this be a seizure or not?
Correct. I think documentation is extremely important nowadays that we have the ability to video events on your phone. I think that will be very important to video those events and take it into your primary care physician and have them review it and determine if your child is or not having seizures.
Okay. So let me turn to Dr. Ficker right now. So the first question is, does the child or adult have seizures? But then the other question is this Lennox-Gastaut? Can you talk about how do you diagnose LGS in a child or adult?
Right. There is no specific diagnostic test for Lennox-Gastaut syndrome. We make the diagnosis by taking a careful history, reviewing the age of onset, the different seizure types that are observed. So it's important for family members to really pay close attention to the different seizure characteristics, write them down if possible, as Dr. Hernandez said. Video is also very, very helpful. We also look at whether there's the presence of developmental delay. When did that start? Is it something that started prior to seizure onset or after seizure onset? Is it something that's progressive? And then we look at EEG. And EEG is very helpful when we're looking for the presence of the abnormalities that are called slow spike wave. Now, the challenge is that those abnormalities are not always present on every EEG that is done. So sometimes on the adult side, I treat patients with adults with epilepsy. We may need to dig back in their history and get prior EEG reports to see if the slow spike wave was present.
So I also work with adults, and just as you mentioned video monitoring, I was thinking about, how is this most useful? Well, sometimes it is to diagnose. I think sometimes, families or caregivers might come in and be reporting different behaviors, and the question is, are these behaviors seizures, medicine effects, or something else? So can you talk a bit about how you might use video monitoring, over the course of one's lifetime to sort out seizures or other problems?
Right. So video monitoring refers to inpatient video EEG monitoring where patients are admitted to typically in a hospitalized setting where they have continuous EEG recordings, and we also videotape them, and we can. And the goal of that study is to record seizures and determine is an event a seizure, is it something else, and if it's a seizure, what type of EEG patterns are seen during that seizure, and that oftentimes gives us a lot of information when we're making treatment decisions and how do we best treat seizures to get them under the best control possible.
So Dr. Hernandez, Dr. Ficker just talked about some cognitive or behavioral changes that could be seen in LGS. Could you start by talking about what that looks like or what might happen in a child, and then we'll ask Dr. Ficker to explain that for adults.
Well, as the seizures become uncontrolled, we tend to see difficulties in children attaining their typical or expected developmental milestones. So seizure control is going to become very important as children become adolescents and adults. And it is important also to know that about 50% of this patients with Lennox-Gastaut syndrome will have some sort of hyperactivity or aggressiveness. The patients that have the symptomatic form of Lennox-Gastaut syndrome, meaning that the patients that we find an underlying problem, they are higher risk of having intellectual disabilities that could be from mild to severe intellectual disabilities. About 90% of patients with Lennox-Gastaut syndrome, as they get older and their seizures remain uncontrolled, will have some sort of mental handicap. Factors that are associated with worsening of cognitive abilities is the frequency of seizures, also the frequency of episodes of status epilepticus, also the association with an identifiable reason for their epilepsy. Older children tend to develop other behavioral problems, depression, they become aggressive. Some patients even could become psychotic with this condition.
Okay. Dr. Ficker, are the cognitive or behavioral issues similar in adults, or do you see different issues?
I think they're similar. Unfortunately, by the time individuals reach adulthood, many times the mental handicaps are unfortunately not reversible. Part of the challenge also is differentiating and sorting out whether some of the behavioral effects and cognitive difficulties are related to the underlying condition of Lennox-Gastaut or related to the treatments. And sometimes that can be very, very challenging to sort that out.
So that leads us to a few times I've heard you both talk about kind of trying to sort this out. So what I haven't touched on yet is what causes this, because does the cause maybe contribute to part of the cognitive or behavioral problems? Dr. Ficker, could you talk about the causes?
Yeah, there are many, many different causes of Lennox-Gastaut syndrome. And when we use the term syndrome, when we're talking about a medical condition, that usually means that there's not a unified single cause in every individual patient. It's not the same cause. So there are many different causes. There could be genetic causes identified. There can be structural problems identified in the brain, whether that's a developmental abnormality in the way the brain develops, or sometimes even neurologic insults at a very young age can be associated with the development of Lennox-Gastaut syndrome. And sometimes we can't identify the cause in a certain percentage of individuals.
Dr. Hernandez, I know advances in genetics have led lots of people to say, how can I find out if genes have anything to do with my child or my loved one's epilepsy? What do you tell parents of children with Lennox-Gastaut?
Well, the first thing I tell them is that the field of genetics in epilepsy is growing. And so far, though we've been able to identify multiple genetic mutations that can cause different forms of epilepsy, there's not one specific genetic mutation has been identified as the cause of Lennox-Gastaut syndrome. But you can have genetic conditions uh, that could have the similar characteristics of a Lennox-Gastaut syndrome um, uh, patient. Typically, um, patients with symptomatic forms of Lennox-Gastaut syndrome will have, like Dr. Ficker said, primarily structural abnormalities of the brain, um, patients that had lack of oxygen to their brain. And there are some genetic causes, but there's no one specific gene mutation that's been identified as a cause of Lennox-Gastaut syndrome.
So that's where research in the future may be very helpful for everyone as we understand not only what these different mutations are, but what role they have, and then does that influence treatment or anything else?
I couldn't agree more. I think the genetics of Lennox-Gastaut syndrome are going to be very complex, and identifying a single isolated cause of Lennox-Gastaut syndrome will be very difficult. But I'm sure we'll be able to find subsets of genetic mutations that have been associated with Lennox-Gastaut syndrome symptoms.
Great. Well, I just want to raise also that I'd imagine as people who are listening to this are wondering, well, how can I find, an epilepsy specialist, or how can I find an epilepsy center if my child has a very complicated form of epilepsy and we think it might be Lennox-Gastaut syndrome? So I'd first encourage people to, as users of epilepsy.com, to go in under our Get Help section where you can find 2 tools for Get a Doctor. To find a doctor, this links you right over to the American Epilepsy Society where you can find epileptologists in your area. If you click on Find an Epilepsy Center, you'll be taken to the National Association of Epilepsy Centers where you can find these comprehensive centers near you. The other thing I want you to be aware of is that the Epilepsy Foundation itself will have lots of resources and help. Read about epilepsy and Lennox-Gastaut in particular on epilepsy.com. You can click on Finding Get Help and use our 24/7 helpline to the foundation. But most important is find an affiliate or an Epilepsy Foundation group right in your area where you can get some one-on-one help, maybe meet with other parents in your area with similar situations. Because I think learning as much as possible, asking these questions, learning as much as possible about what you're dealing with is critical, but then also getting the support and help that you need is very important for all. I'd like to thank Dr. Hernandez and Dr. Ficker for joining us on Dare to Ask Spotlight on Lennox-Gastaut, and we'll be coming back for phase 2 to address treating Lennox-Gastaut syndrome. Thank you very much.